Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100-plus globally accredited certifications across emerging and in-demand domains like Generative AI and Emerging Technologies, HR and Learning and Development, Project Management and Agile Scrum, ISO and Quality Management, Information Security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500-plus multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100-plus authorized training partners and 50-plus universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000-plus members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100-plus globally accredited certifications across emerging and in-demand domains like Generative AI and Emerging Technologies, HR and Learning and Development, Project Management and Agile Scrum, ISO and Quality Management, Information Security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100-plus global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500-plus multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100-plus authorized training partners and 50-plus universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000-plus members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100 plus globally accredited certifications across emerging and in-demand domains like Generative AI and emerging technologies, HR and learning and development, project management and agile Scrum, ISO and quality management, information security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100 plus global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500 plus multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100 plus authorized training partners and 50 plus universities, supporting talent across all career levels, from entry level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000 plus members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the...
Hello everyone, we'll be starting the session now. Please allow me to share my screen. Here we go. I hope my screen is visible to you all. And thank you everyone for joining today's session. And I welcome you all to GSDC Certified Learning Implementing Generative AI in Healthcare, with a theme that is transform patient care and clinical workflows with AI insight. So we have scheduled this entire webinar series from 6 to 10th October 2025 with the time slot that is 8:30 a.m. Central, 9:30 p.m. Singapore time. So do join us for all the remaining session, as we are having incredible panel of AI healthcare experts aligned for this entire webinar series. Also, today we'll be having Junaid Kalia with us, and he'll be taking us through the topic that is artificial intelligence in healthcare, distinguish value from hype. So, before he could start with his session, I would like to introduce our hosting organization, GSDC. We known as Global Skill Development Council. We are vendor agnostic, vendor neutral. We are globally recognized certification body, and we are accredited by ANSI and ABICB. We do have 100 plus certification portfolio with us, and we have certified more than 250,000 professionals worldwide. We have 500 SMEs, those are subject matter experts, industry experts. They work with us closely to design our deliverables, and we are associated with 1,000 multinational corporates and 500 Fortune companies and 30 plus universities across the globe. And I'm very proud to inform you all that we do have a 100 plus authorized training partner across the globe. We have partner in Asia, Africa, Canada, America, and many other countries. So I would love to thank you those who have joined us through our training partner channel. So in case if you're looking for any training program for yourself, you can definitely reach out to our training partner. I'll share the link shortly in the chat box. So you can reach out to them for further information to inquiry if you have inquiry regarding these training programs. A special thanks to our official media partner, World Press Hub, for covering all our events and press releases. So as I mentioned earlier in my previous slide that we do have 100 plus certification portfolio. So our current certification portfolio holds certification on emerging technologies, agile DevOps, quality compliance, learning and development, digital transformation, and so on. So in case if you're looking for any of these certification in order to upskill yourself, you can definitely reach out to a learning advisor to get more information, details regarding this, or you can check our website that is www.gsdcouncil.org to check all the details details and to check all the offerings that GSTC has for all of you. So, what benefits you will be getting with this certification? So, you will be a GSDC member for a lifelong. With that, you will be getting certificate upgrade, and you will be having free access to all our events, workshop, boot camps, and guess what? You will be getting free access to all our exclusive learning program that we have. Along with it, you'll be getting implementation resources, speaker invites, and newsletter. Isn't it great? So do grab this opportunity and do sign up yourself for this amazing certification program that we have. I'll be sharing all the links in the chat box shortly so you can check it out. So, without any further delay, I would love to tell you all more about our today's speakers, Junaid. Junaid is MD and neurocritical care, stroke, and epilepsy specialist and founder of SaveLife.ai, pioneering AI-driven solution in neurology and clinical automation. He completed fellowship at UT Southwestern Medical Center and neurology residency at St. Louis University with advanced training in digital health and AI. Through his non-profit Institute of Health Innovation and Education, he provides no-cost AI healthcare solution to underserved regions. We are very delighted to have you, Junaid, with us today for this session. Thank you very much for joining. You can have the virtual speaker now. Thank you.
Hi there. Can everyone hear me and see me properly? I just want to make sure before I go into this. And is my screen being shared? All good? I'm sorry, I cannot see the actual. Okay, perfect. Hey, good morning, everyone, and good afternoon or good evening, wherever you guys are joining from. I'm Dr. Junaid Kalia. I'm a neurocritical care, stroke, and epilepsy specialist out of Dallas, Texas, and we formed a company called Save Life AI. The whole mission of the company is if you save one life, it is as if you save the life of all mankind, and it is from all the major religions, believe it or not. So I'm very glad that we are actually on a mission to do this. The topic today is distinguishing value from hype. And this is something very dear to me because there's a lot of hype outside for AI, but the whole point is, are you actually delivering value? And that is a very important core feature that we want to understand. So first and foremost, why you should listen to me. Am I going to deliver value to you? So that's where I actually you have to understand when you're choosing your mentors or whatever that may case may be, educators, that they are really bringing you value because your time is important. I am a physician. I actually have a company that has high trust cybersecurity framework certified and FDA approved class 2A clinical decision support. So it is not a hoax. It is not something that I'm actually going to present to you. It is actually learned and applied and approved regulatory approval. So what I'm essentially saying to you is that make sure you always check what the credentials are for the people who are actually doing this, because it is important for you to understand that those who have actually done the work is actually showing the work as compared to just showing the work itself. The other thing that I want you to understand is that whatever I say is going to be basically bull crap in 6 weeks. The industry is moving so fast that it is insane. So, for example, just going to give you an example. Today I was at another podcast and we looked at generative AI cost. Is it going to be a cost effective or not? So that is very important thing. Then there is a Google research paper of personal health agents. So these are just within the last week updates that I'm actually, saved so that I can read them. So it is very important for you to understand that whatever I say is going to be outdated. And it is insane to catch up with the industry and the technology as we go along. So just to go, again, we always have to say disclosures when we are as physicians, understanding that, of course, I invest in AI companies, I accelerate AI companies, I founded two AI companies, and of course, I'm an advisor to multiple AI companies as we go along. The objective is that you need to understand what the hype cycle actually is, what are the true basis of AI in healthcare. Then we're going to move into applications, defining true value. And if one of you are going to have an entrepreneur spirit, do reach out to me on LinkedIn. What we're going to do is we're going to figure out what are the moats, because it is essentially a harder industry to break into. So I just want to make sure that you guys understand what I'm saying in terms of that. Also, please feel free to ask any questions you need to ask so that this is going to be generally a more interactive session as well. So where is the hype cycle? In 2015, self-driving cars were supposed to be there in 2 years, so 2017. In 2016, Jeffrey Hinton, which is actually the godfather of radiologists, said that radiologists will be obsolete. And today, in 2005, all my radiology friends are driving to work and looking at all the radiologists. As a matter of fact, there's a bigger hole to fill here in radiologists in USA as compared to any other, subspecialty, including neurology, which I am. My base specialty is neurology, then neurocritical care, stroke, and epilepsy. So you're going to see that there's a lot of goddamn hype, and this has been going on for some time. But the real question is that is it going to drive value, and what is the time scale of that value scale? The hype cycle is always where we go through. There's a technology trigger, which is the chat GPT moment, and then peak of inflated expectations. And then we actually went through the trough, which is last year. And now we're seeing what we call slope of enlightenment. The slope of enlightenment actually is now that we are seeing significant adoptions. One of the examples I say is that the largest health conference over here is called Chase, held by, believe it or not, Chase Bank. And Chase actually holds in San Francisco a conference in which mainly the industry decision makers are there. 2024, I went there and they said that, you know what, we're looking at it. When I talk about AI in healthcare, eyes roll out, etc. In 2025, this year, people were coming back to me and asking me, hey, here's my budget. What should be my first priority? So things have changed significantly as we move along because decision makers are no longer allowed to dismiss this. Because again, those who are on the decision making scale, they need to understand what is the hype and the project as well. So we need to understand. And then the second most important thing, and this is Satya Nadella, CEO of Microsoft. Artificial intelligence represents one of the technology's most important priorities, and healthcare is perhaps AI's most urgent application. So what you're looking at is that a significant shift from all of them. Khosla Ventures, again, a 5 billion venture fund. The opportunity for AI in healthcare is here and now. This is again January 31st, 2025. I'm going to take some water breaks in the middle. And please, if you have questions, the host will stop me and you can ask them. What is the basics? Because the basics are extremely important, especially when we are considering AI in healthcare, because people don't discuss that. Essentially, AI works like magic. And my job here is to understand that how you're going to go from a muggle to a magician, because it is so highly addictive. But again, understanding how to apply it best is the real challenge. What we have is that first understanding that how AI is actually built. AI is built on artificial neural network. Artificial neural network, believe it or not, it's completely based. Again, remember Jeffrey Hinton that I talked to you about in 2006? Actually developed the godfather of AI, literally modeled it exactly like a neuron is. You have all these weights and biases that goes through the axon and then connects. And then if you go through the, forward and backward and all of these are basically layers of weights that go through. It essentially represents a neuron at the very basic level, but when connected, essentially a brain. And as a matter of fact, there is a hierarchical reasoning model that we are looking at now, reasoning engines, and we're looking into these. You're going to see that the hierarchical reasoning model is actually literally also follows the brain anatomy pattern, because we actually have a vision center, the language, the audio center, in between the memories, the language center, and you're going to see that we are essentially modeling a human brain. Why is that important? And the important part is that there's a huge shift. How computers used to learn and how humans used to learn. Computers, we had to give if, act, then statements, right? If X equal to Y, then Y equal to Z, and therefore the answer is Z. That was human coders sitting there in version 1 of human coding. And now in the second era, the version 2 of the deep learning, here's a bunch of examples. Here's a, million images of cats. Here's a million images of dogs. And you figure it out which one is a cat and a dog. This exactly now learns as human does. If you have kids, you now understand that you don't teach them language. They 1.5 years, they gather some words, then they grow up, then gather more words. And essentially, they actually learn language as if it was through examples, right? I mean, of course, we teach them, but the idea is exactly like the humans learn. That is the difference. AI is like another human brain, literally. And therefore, the biases, that issues come in. Well, of course, the difference is now that every AI is at a PhD level, and that is going to be a concern for future job prospects. Machine learning purpose is essentially, at the end of the day, on the back end, it's all about prediction, prediction, prediction. So when I say a cat and a dog image, when I actually get the result, it gives me literally like a clinical trial: sensitivity, specificity, accuracy. What that means is that you actually get to know that this next image that I sent you, what are the chances that this is a cat and a dog? And believe me, this is how we run clinical trials. This is how the whole scientific basis is done. Because if I'm going to tell you that here's a medication that's going to treat your headache, what am I telling you exactly? There's a chance, right? I mean, we have done multiple clinical trials, etc. There's a prediction that I made that because you have this body chemistry, these allergies, etc., so this medication is the best combination. That's what I did in my neural network. And the same thing can be done and replicated in the artificial neural network. I hope everyone's understanding this core concept. Now, talking about AI in general. So AI in general has three big pillars. It used to be three big pillars. Everything is now basically becoming one. Number one was the computer vision, essentially cats and dogs rather than CT scans, gallstone or no gallstone. Same, that's a computer vision. Then you have natural language processing, and within the natural language processing, essentially, AI scribes, other, essential modalities in which when I speak to someone or give it a text prompt, it gives me information. And now, of course, these two actually got combined, and we're calling visual language models. And as I said, AI analytics used to be a separate machine learning problem. We used to basically have continuous data, EEG, EKG, all of this blood pressure readings in the ICU, and that is called AI analytics. And now we are combining into vision and language to turn into visual language models, and then we're adding even analytics, and now it's a full multimodal model. And what does that really mean? If you really look at the back-end architecture of artificial intelligence, what you're going to understand is that it is called transform anything. The word is transformer model architecture. That benefit is that the people think that this model was the biggest thing. Actually, the biggest thing they did was they understood how to make anything into zeros and ones. And that process essentially is called vectorization. It could be text, audio, image, 3D, video, DNA, protein, molecule, animation. It does not matter. As long as you can vectorize it, then you can actually push it into the transformer model. And that transformer model is actually the generative AI portion of things. And it can retransform into any other output. So if you give it a text, make me a picture of a dog, it's going to basically give you, animation, video, image, whatever you want. Same thing, you can put into the audio, comes back audio or whatever that. So the transform architecture, again, is essentially the same thing. I read, I process, and I speak. So as a human brain, we went from text to audio. So this is exactly, again, mirroring the neuronal pathways, and more importantly, understanding the architecture at the back end is extremely important for you to develop true value-based applications in healthcare. Okay, now we talk about the opportunity. If you look at the healthcare as a whole, the opportunity is insane. And this is essentially done with multiple studies, like how, if you put in and invest $1, this is called return on investment, ROI, which is a very important term that you need to understand, because if you're going to do something about it, you need to understand how much are you going to invest to how much you're going to get in what timeline. And that timeline is essentially, we talk about 1 year. And if you invest $1, essentially the return on investment in artificial intelligence in healthcare is $3.20. And this is basically much higher in other places is concerned. As a matter of fact, the market growth trajectory we're looking at is, 2034 is $613 billion. It is an insane opportunity globally for artificial intelligence in healthcare. I'm just going to show you, we have an application called EyeSIMD. It is increasing annual revenue by 200,000 per physician here in USA. If you look at the significant so there's a hard ROI, which is actual numbers, dollar amounts that you're getting. If you have non-dollar amounts to understand what is the impact going to be there, reduce burnout, higher satisfaction, 20 plus care time, less work hour times, huge soft ROI as well. So soft ROI is where you can actually bundle them in the sense that if I'm going to be able to leave the job, if I leave a job, to replace me right now in my situation is going to cost $100,000 here in US, because just finding the person, interviewing the person, training the person, all of that, credentialing, 6 months of time, etc. So that's how bad how it is. And in certain cases, I mean, this is another of our products. I just want to make sure that you see the idea is that it's $8 of healthcare AI per $1 invested. These are studies that are done through PubMed published. The idea is to understand that there is a massive, significant opportunity in healthcare and AI. Now let's just talk about computer vision. So what is the true reason that computer vision is so important? So this is a deep learning algorithm for automated detection and classification of acute intracranial hemorrhage in head CT scans. By the way, this is from our company, is available for free for low income countries. And this is available on an Edge AI. This is actually Orange Pi. It's a CNN-based model. This is not my study, but what I'm saying is that we have done it. We have FDA approved all of that. And the idea is that it is available. Why? Why is it important? That's the term, the value. As if you come in with a stroke, which is a paralysis attack, every 1 second, 32,000 neurons die. How many? 32,000. In 5 minutes, you can lose a limb, ability to speak, hearing, vision. Insane amount of disability comes in. Even if you decrease the latency of care by only 1 minute, you can save so much disability. As a matter of fact, it is estimated that stroke is the highest disability, of course, globally, especially here in the US. But more importantly, if you can just decrease the latency of care, it can be so stupidly important. There's no question about it. And here's the kicker. Why do I need that then? Well, I'm a scanner. I mean, I can see the scan if possible. But again, sometimes I can't because I'm in a different part of the world, apparently. But the more important part is that, if you look at the sensitivity and specificity, it's insane, 97 to 97%, and depending on it. It is 95%. It's a perfect co-pilot. I mean, maybe I'm sleeping at that moment. Maybe I had a fight with my wife. I don't know what happened. Humans have their own capacity. But when you add this superb, beautiful co-pilot, first of all, the speed of me taking care of these patients, much faster. For me to make decisions, much faster. For every minute, not hours, not 20 minutes, 15 minutes, every minute, there's a significant improvement in the patient's disability. And the same thing happens in radiology. The radiology market is actually a little harder to understand because what that happens is that you can have liver, lungs, whatever that case may be. But the point is that the FDA approval process is actually limiting for us to really build true foundation models just yet. We're seeing the approach to it. We're seeing the start of it. That whole abdomen is now at least being done. There's a first FDA approval that went through. But essentially what they do is they have this modality, which is CT, MRI, X-rays, or they have the body part, which is, brain, chest, abdomen, breast, whatever. And then the pathology, which is bleed, no bleed, obstructive hydrocephalus, etc. So they have all these things applied as separate, and then they approve it. But we are looking at the future in which foundation models in radiology is going to go, but it's still going to be per modality. You're not going to see one model that takes care of MRI, CT, ultrasound, everything, because these are so different ways of doing it on the back end. But we're going to start seeing foundation models in radiology per modality. I mean, there are multiple companies that are developing it, including ours. But the problem really is that how to get it FDA approved, and that is going to take some time. And we're finally looking at this computer vision. The trajectory of the future is foundation models in radiology, but per modality. Interestingly, we have another big imaging device, and which is pathology. Again, I'm going to tell you about ultrasound because ultrasound is a video essentially and has multiple images. So your assessment in terms of building models is very different. And it's very important that you need to understand that if you are actually looking at all these papers, there's significant issues with fairness, privacy, robustness, reliability, explainability. And you really need to make sure when you're implementing it within your solutions, you are approaching it from a trustworthiness issue. We actually did that. This is the Care One Foundation model that I told you about that is actually now getting approved. I'm sorry, I just didn't know. Here it is, computational pathology. Pathology is different because if you take a snip out of here, or eye or tongue or everything, what really happens is that it actually has A whole slide that you make, and then gram stains and all of these stains are fairly reasonably done in the same way, in the same portions. Of course, there's definitely differences in a liver cell and a brain cell, but these things are still less obviously different in terms of a CT scan, which is actually an X-ray based beamforming technology, as compared to MRI, which is actually essentially looking at water molecules. So the reason we are seeing in pathology is that the pathology, you will see a faster movement towards what we call a foundation model. Um, Again, I talked to you about computer vision and the trajectory, how things are going to move. And then I'm going to talk to you about NLP. NLP essentially is LLMs, large language models, ChatGPT, Claude, Gemini, etc. And the idea is to understand language, and that is natural language processing. And the idea is that you need to understand what its core technology is. Again, prediction, prediction, prediction. It literally goes through word by word and predicts the next word. So even if it fills out a lot of shit, at the end of the day, it is going word by word. Again, this is why GPUs are so expensive. It requires so much electricity, etc. I'm not going to get into the details of how things are going to change in the future, because we're looking at how it is going to move from digital memory to analog memory. And we're going to have 1000x improvement in inference speed within the next 5 years. But more importantly, you need to understand that healthcare can scale. These large language models are what we call all-purpose prediction engines, and they can predict so many things, right? They can predict if you're going to have an in-hospital mortality, blinded index manipulation, length of stay, insurance denials, insurance approvals, reimbursements, you name it. It can take your whole summary now, because we have a higher context window, and it can tell you exactly where you're going to be able to put this. So again, it is again a massive opportunity. The good news is that there's no real approval process here in USA. So people are building shit, but that is, by the way, is going to come down the pipeline. As a matter of fact, FDA is actually already asking for. I'm sorry, why is this? So this is already requesting for public comments, how to measure, evaluate adamant in real world. So we're going to see these changes coming in the very future soon, as FDA goes and cements its process through this. Now, this is, again, another big thing, that if you look at the trajectory of the large language models, with starting from 2009, which was T5 model, stupidly crap, to all the way through all of this, and this is still not 2020, this is 2024, we're going through this. DeepSeek, Gemini, now we are not Gemma 2, we are on Gemini 3.3 is going to be released sometime end of October. It is insane, the amount of improvement that we have seen, and the improvement has been insane. As a matter of fact, if you look at it, it's not just an improvement in terms of efficiency, which I'm going to tell you, but more importantly, given that they are able to produce this, there are countries around the world that are implementing it. The DeepSeek's model is essentially in China. If you look at this, January, February 2025, look at this. It is per day total number of hospitals in China using DeepSeek. It is insane, the amount of adoption and how fast that adoption is. Again, in FDA really restricts here, but in different countries, depending on different regulation, again, healthcare is highly regulated. Environment globally, including India, for example, they have to have data servers inside India to be able to provide PHI or anything. So these are things that you need to understand globally. Same thing with Saudi, same thing with Qatar, USA. Actually, USA has less, and Canada can share boundaries, etc. But at the end of the day, this is becoming a true reality very fast. And then why? What am I saying? What happened essentially was that when you actually look through the large language models, they decreased in price. For a million token, lower is better. So we are seeing that all of them are decreasing. Llama 4, Grok 3, Quinn. So overall, the price curve has gone down. The speed has gone up, right? Look at the Gemini Flash. It's 3,341 tokens per second. Insane with the reasoning model. And then more importantly, intelligence has gone up. So with the advent of these three things, when you're having lower price, increased speed, and increased intelligence, what is the end result? End result is you can develop agents. So this is the new NLP, where you are actually using one model in a string or a parallel format to actually do this. Oh. And then if you look at the real prices, I mean, it has 900x per year. 900x. It is insane that how fast the cost has gone down when we go ahead. Again, decreasing cost, decreasing latency, increasing intelligence, and now we of course have multimodal. And then the word retooling is considered, for example, now we use MCP protocols, which are more famous in the general development community. But even here, let's say in a specialized community, we have more API access for electronic medical health records, HL7, FHIR, DICOM, etc. And we are seeing that the tools are easily connected to these models. And then once you have all of this, you are getting what? AI agents. Just to give you an example, agent number one would be speech to text. You're going to speech, hey, I want to make this appointment with Dr. Kalia on September 3rd. The LLM is going to go ahead and check with the tool usage that if I have an actual appointment book, the patient is going to say, yes, it is available. It's going to say, a text appointment book or TTS, text to speech, and then it's going to say over the phone, hey, your model is booked. So you actually use 4 agents in parallel to actually accomplish this task. So these are AI agents that we are looking at the next evolution of large language models. I'm not going to go into a lot more detail of how agents is different than AI, agentic AI. One AI agent can actually do a couple of things, but when you have agentic AI, you're essentially pulling 2 or more agents into one workflow. And then one of the things that I'm going to discuss is that the workflow is one of the key areas in which you can have a moat, because healthcare, it is easy to believe in it. It is easy to design technology. Medicine is easy too. Taking care of people is the hardest. HR operation, patient operations, etc. Clinician operations. So when you have workflows, that is one of the biggest moat that you can create in terms of execution, coordination, network analysis, and all of that. So if you're looking for a moat in healthcare, look at this. Now, I'm going to take a 2-minute break and then ask if you have any questions up till now, and then I can continue. Do you have any questions for me? Okay. Silent crowd. That's fine. Go ahead, Jishana. Jishna, sorry.
Thank you, Janine. Do you want me to read the questions for you, or you'll be
Yeah, I
accessing
mean,
it?
I want to, because then I'm going to forget at the end. And then, so people, if have their questions, please go ahead and ask. And I'll take breaks in a minute.
Sure, sure. I would like to request all the participants, please drop your questions in the chat box so we can check it.
Okay, go ahead, start putting in the questions. I'm going to continue presenting, and then I want you to, again, more importantly, learning is an active process. If you're just going to listen, believe me, it is very hard. So now the agentic AI is the era of this. I'm not going to show my stuff because that's proprietary, but I want to show you 3 examples from the 3 kings. Number 1 is Microsoft, number 2 is Google, and number 3 is ChatGPT. And they actually use the word sequential diagnosis, this one towards physician-centered oversight, and AI-based primary clinical support for primary care. And that's actually a real-world study. So let's go ahead. OpenAI essentially said that we're going to go ahead and do 22,000 visits. And with these 22,000 visits, we're going to have an AI response there. So first, if you have this initial documentation, I do that all the time. And then AI consult is there. An AI consultant basically is essentially working as a co-pilot, is saying that treatment involves metronidazole, which is not indicated in non-complicated gastroenteritis. And therefore, you should use protoprazole, which is actually true. The idea is that this can be another area in which we can do this, and then it can suggest metronidazole prescription removal. This is the tool, right? When I'm actually in the EHR, when I'm in the order, that is essentially an HL7 FHIR backend that you are going to go ahead and do that. So I want to show you exactly how these things are changing. And what they results is that AI consult improved the quality of care they delivered, with 75% saying the effect was substantial. So these are actually real-time physicians with real clinical visits that we are seeing that there's a huge impact. The second, of course, is from Microsoft. They actually took another way, and that's actually, I like this way. They actually created a medical orchestrator. Within that orchestrator, they actually created 5 different agents: checklist agent, stewardship agent, hypothesis agent, test chooser agent, doctor challenger agent, and then there's a virtual doctor panel essentially sitting. And the idea is that within that, you can ask a question, request a test, provide diagnosis, and this way you can actually go ahead and do that. And this MAI DXO achieved 80% diagnostic accuracy, 4 times higher than the 20% average of general physicians. Are you kidding me? And then, more importantly, reduces diagnostic cost by 20%. It is insane. And nothing, they did not do model retooling. They just orchestrated it. And that's why they call it MAI Diagnostic Orchestrator with diagnostic 70% compared to off-the-shelf O3. Because they were able to orchestrate it so much better that if you just keep asking questions on O3, the tokens are going to go away. And they give you very beautiful examples. Again, I've actually shared the link of this talk in the chat. Go ahead and grab these links in there so that you can actually review them in detail. And then, of course, you can see, okay, test request, contrast, and anesthesia. If the neck or through, show the lobulated. Then you can actually go, okay, should I do this? Should I do this? So you can keep going. And this is a radiology sub-agent. This is a lab sub-agent. This is another, order and verification utilization expert. So you can actually go through these processes as we go along. And then, of course, Google came into, and then Google has a different way of approaching it. Anyways, this is, again, clearly the clinician co-pilot. You actually go through a patient transcript, subjective assessment, and then it gives you, the physician they give you a physician, the user experience. That, by the way, is another mode. If you're building any AI, user experience is your big mode, because if it solves that workflow and UI problem, you have a product. Because the mode is there. The mode is not building in foundation models because they're getting cheaper, faster, and easier to get. Anyway, so they look at oversight. So the way they built it is through an oversight agent, and then they actually go through this. You go ahead and see this, overseeing PCP, review, edit, submit, oversight experience, and they can actually go ahead and help you go through the exact one. Again, these results are made across 60 scenarios, outperform both groups in performing high quality intake, summarizing cases, diagnosis, and management. Now, what is the biggest problem with healthcare? Because healthcare is actually an immensely problematic in terms of integrations, PHI regulation requirements. So first and foremost is interoperability. EHRs is a huge issue. Then the problem is, if you really want to train proper, because that's where you can decrease the cost. Small, large language models are the future, and embeddable. I mean, you literally embeddable large language models is going to be the future. That is actually significant problem to acquire quality data. As a matter of fact, a lot of data that comes through from high-end institutes, believe me, high-end institutes here in the US is quite garbage. I mean, interestingly, some of the data from India was actually much better because they only wrote small, short sentence, but that was the key problem that we needed to solve. And data privacy and security issues are, again, significant. We are high trust cybersecurity certified, HIPAA, and all of that. But again, there are, I mean, if you're building something in AI, I'm just going to be honest with you, fintech and health tech are the hardest one because they are the highest, most regulated environments. The second biggest problem with healthcare is that there is a curse of dimensionality, right? You actually have the disease data, which is genomics, radiomics, clinomics, biomics. Then you have the health data, Apple Watch, ECG, microphones, all of this. I mean, you generate basically, bodies that generate data. And then, of course, you have claims data, right? If the insurance is going to approve, pharmacy is going to refill, and then labs, etc. And then finally, of course, we have clinical trials, biobanks, registries, all of this. So there's a huge import. And when I say curse of dimensionality, what do I mean by that? Each one of them is a data point. So what, right? But the problem is that Junaid Kalia's body, what it is today, is very different is going to be in 6 months. It's going to be different in 6 years. So there's it's not just XYZ, it's actually the T, the fourth dimension, which is the time. So it doesn't actually stay static. It actually, constantly changes. So, I mean, for those of you who are interested in pursuing this, it is important that you understand. And this is our approach, by the way. We have an agentic approach, multimodal approach, and we are developing small language models, which actually does very small important shit. For example, one agent will be doing just diagnostic, one agent will be doing this. And the idea behind it is that we combine, string them together, and may be able to develop at some point in time. It's not going to be as small as this like $70 nano devices or something, but it's going to be at least $5,000 GPUs at the moment. And who knows, maybe in the future, we will be having, NVIDIA Jetson and stuff that is going to improve enough for us to be actually able to embed them. So one of the things that I do is sometimes I actually give you the choice. Do you want me to talk about value, defining value in more improved way? Or do you want me to talk about AI healthcare businesses? So I'm going to take a break and then take some questions. And then whatever the host decides, I can do one of these two modes. Do you have any questions for me or suggestions? Which one would you like to see? Lightning round 1 or 2, just put it in your comments. Okay. So great couple of questions. Let me just stop the share and then first answer these. So number one major question about healthcare is it auditable? That's the word. And that's a beautiful word, by the way. In artificial intelligence, the whole point is that, let's say as a doctor, I'm seeing you, right? Am I going to choose urinary tract infection? I'm going to give macrobid or I'm going to give nitrofurantoin. Do you know why, how I chose it? Nobody does, right? That's nobody questions it because we have been doing it for 1,000 years. But there's a black box in me, by the way, right? And we try to do it, especially with EHRs, EMRs, we document our medical decision making. But let's just be honest, like, am I able going to be document ever? There's a black box everywhere. It's just that since we're doing it with a machine, we're demanding it differently, and we're again comparing with a human. There's definitely a black box that is auditable. That is a true word. Auditable means that we done tons of studies, right? I mean, we trained over 1 million images. Then we actually had to go to FDA that actually gave us a set of data. We had to compare. We have to give them that this is the US data, this is X data. It's gonna populate. It's gonna be generalizable. All of that. So these does FDA performance testing. We did it, and they are doing it. In large language models, the process is not there, but we can do it. There is a traceability. There is actually auditability. The question that you're trying to ask is that explainable? I don't think so that in large language models, we will be able to go to explainability. People have done a lot of work, but unfortunately, that is not something that is true. I didn't see any other question coming through right now, unless I missed it. Let me, okay. So the other question was that optimized models for drug discovery and precision medicine. So yes, when you are looking at these three big areas, right? Because what you're doing is image analysis. So, and then the second one is lab language models, and the third one is AI analytics. AI analytics is where the clinical trial data exists, and that clinical trial data can be pushed into patient's chart, which is NLP, and then patient images, which is biopsies, radiology images, etc. And then you're truly building what we call multimodal. The drug discovery is going to be an amazing, awesome process. We have already had one antibiotic that was actually already in the process of getting approved, which was gone through a company that developed AI specifically for drug discovery and is going through the testing process. As a matter of fact, this is a huge industry. I forget the total numbers, that how much it is, but in general, the new drug to market is now 15 years life cycle, and because of AI, the first one is gone down to 7 years, and we are looking at the acceleration of both doing the finding the drug, but also going through the whole clinical trial process to down to 3 years. So we are going to see significant disruption in that industry. Again, I'm not an expert. I'm just giving you market reality. So I think you should get some expert to talk on that. Go from there. Um, okay, I'm going to go ahead and quickly go through these modes, and then, of course, we can take dedicated time to actually answer questions. I just want to always engage the audience because I can't see your faces, and then it's important that we go from there. So the most common request was lightning round AI healthcare business, and then we're going to go ahead and talk about that. And then, of course, one of these days, I'm going to talk about value in healthcare in terms of how to develop true value. I'm not going to demo my product. Before I actually go into this lightning round, again, you need to distinguish what is value and why. And then again, call to action. You need to embrace AI. You have to learn it, and you have to foster collaborations, especially when you're talking about AI in healthcare, because you need data, you need experts, and you need to actually be able to, communicate. So always do that. And the last thing is that it is very important for you to understand, especially if you're a physician's nurse, etc. It is not here to actually replace you. As a matter of fact, this is a very stupid thing to even consider because I told you, radiologists are still needed. You need to augment, you need to assist. It is actually appliance, it is ambient, it is semi-autonomous at the moment. It will get in some places autonomous, full autonomous. But this is what AI is here to do: augment you, assist you, apply at different situations in a basically go away part, like it's ambient form. So it doesn't show up. It's basically you. And then the idea is it is going to be semi-autonomous. But the goal is not to replace providers. The goal is the physicians who do not use AI will be replaced by the ones who do use AI. Now, this is my LinkedIn. Again, I sent a link. Make sure you follow it. So I'm not going to go into value right now because people are talking more about this. So I just want to give you one example. Long-term savings 10-year model, if you see that the diagnosis actually went from this much to this much, and the treatment cost gone from this just because we were able to find, X amount of diseases early, literally early detection, which is like easy to do. Now, I'm not going to talk about medical legal, etc. These are things. And then I'm going to talk about AI mammal screening. Sweden's study was done 100,000 participants or so. That was increased detection of aggressive subtypes very fast, more small lymph node negative invasive cancers detected, all of this. So there's clear benefit. Now let's talk about AI healthcare business. Now, when you are developing a startup or a business, what you are essentially developing a service or a product, and everything is basically as a service. Infrastructure as a service, software as a service, I don't know, freaking lollipop as a service, because everyone just freaking names everything as a service. Can you keep me on time if I'm actually going over? So the idea is that once you are actually doing this, you have to actually find out how do you develop a moat? How do you define a moat? A moat is a unique selling point, essentially. What is different about you? So right now, I told you I can deliver on edge. So you don't need to upload, download. You don't need it. You don't even have to use significant electricity because I'm going to use USB-C powered. Literally, you can use a cell phone battery pack to use my AI next to an ultrasound or a portable chest X-ray in the middle of Uganda. That is a what? A moat. Okay, so these are the kind of things that you have to understand. So moat is developed into 5 categories. Streamlining regulatory process, which is very important because if you're not going to get regulation, you don't have a product. You just have a model. And there's a huge difference that people need to understand the difference between a model and a product. What is the difference? Model is this, clinical research, excellent work. But what is the difference about this and this? You need regulatory approval. If you don't have FDA, you can't sell. So it's very important, streamline. I talked to you about delivery, multiple modes of delivery, mobile, web, edge, which is this is near edge, which is right next to the machine. Then there's far edge, then there's private cloud, and then there is global cloud. So you need to have delivery on the whole things. Deliverability in terms of applications, I told you about, it should be able to do mobile, web, tablets, etc. And that is actually a real moat. Believe it or not, it's very hard to do and consistently scale on it. Multimodal is extremely important. You need to be able to do multimodal. And then last one is agentic. So let's just go into one by one examples. So how do you go ahead and even deliver regulation? I mean, global regulation is an insane problem, right? I mean, one of the reasons I'm not in India right now is because I don't have the capacity to review regulatory requirements. Believe me. I mean, if they're going to come and punt me that say, hey, you cannot do this, you need another regulation. I want to give it out for free because I don't have time to go through the regulation process. Because, again, it's very hard for us to actually go through this. It is an insane, hard, big problem. So first of all, of course, HIPAA is stupid, but it is there. And then again, more importantly, you have to understand that regulation doesn't stop by one approval. That's what I want you to understand. You get 20%, believe it or not, I have the FDA approval process, right? I have 100% of the application. That 100% of the application, 20% is what to do with what? The clinical portion. Another 20% cybersecurity, another 20% quality management, another 20% software cycle management, another 20% post-market surveillance. Insane. A whole FDA application that I've done and I'm approved and I have 3 more coming. What did I do for that 100% of the application? 80% has nothing to do with the goddamn clinical work. What is the work? The 20% of it. So you need to have a true, powerful regulatory process before you even get into developing AI healthcare business. We have a whole compliance super sheet, but anyways, delivery in terms of deployment. Again, you need to be able to deploy, as I said, there are 3 near edge that I showed you. Then there's far edge. What that means is that near edge is basically next to the ultrasound machine or portable chest X-ray or whatever CT scan. Then there's far edge, which is the DICOM server for the whole hospital, imaging center, whatever. And then there's private cloud in which they're going to say, okay, we have 5 imaging centers, but we want it to be, centralized in that cabinet. And then it's going to be, of course, public cloud, which could be Oracle, Google, AWS, Alibaba, whatever that case may be. So you need to understand that this is very important that you are able to, when you create a product, you're delivering because customer demands are going to be different. Everyone's going to have a different need. And therefore, we have what we call multi-tenant system, but it's actually multi-cloud, multi-system as well. Because again, it's times Saudi doesn't have an AWS server right now. They're building it. GCP does. Alibaba does. So there's a server in Dammam, but there's not a server in Qatar. So you have to be very flexible in terms of ensuring what you're doing in terms of delivery. Delivery in terms of end devices. And again, this is very important because believe it or not, when we develop applications, we developed it on mobile first because the world has gone mobile. And then make sure that you have it available in App Store, Google Play Store, Chrome extension, Mac OS, Windows. Again, the expectations are that it is going to be global and it runs everywhere as we go along. Multimodal, again, I wish I could actually share this, but anyways, while you're actually looking at the bleed in the brain, what we did is that it's going to be automatically generating a report for you. So the vision model connects to my NLP model and then pushes us. We do separate. We didn't do a visual language model because I told you we believe in small models that can fit on devices and can do forward. So the idea was that you actually develop multimodal approach because that is the future. Because vision, everyone's doing it, NLP separately, everyone's doing it. The real mode, the real benefit is going multimodal in the future. And then we're going to go ahead and, as I said, workflow. Because at the end of the day, it is the orchestration. Remember the Microsoft word? Diagnostic orchestration. The orchestration part brings the most value in terms of bringing these things to the market as fast as possible. So it is very important for you to understand that if you're getting into this now as a future entrepreneur, and hopefully I'm glad that this fine institute is training you guys, you need to understand that how it is going to become, the future is going to be, and go from there. Again, the last thing you need to understand is that value on investment, VOI. Value on investment, you always take care of it. It has 2 components. One is called hard ROI. Hard ROI means actual dollars, and soft ROI, which means decrease iteration, decrease staffing demands, decrease overall time. As a matter of fact, if you can read an echo in that speed from 29 minutes to 14 seconds, because we are generating a whole pre-report for you, then the question really is that how many more patients you can see, how much that particular institute is going to be able to grow. So always when you're developing a product, you need to understand what is the VOI. There needs to be both components, the hard ROI and the soft ROI when you go through this. And again, we are going to see this going approach more and more. Now, I talked about the unique challenges in healthcare. And then there's a significant longer implementation timeline. The sales cycle in terms of healthcare is 9 months to 18 months. It is insane. The lowest sales cycle in here in the US is 9 months, but it has amazing resilient impact. Most contracts are 3 to 5 years. And then once they're baked into it, it is essentially very hard to actually move. So you are looking at essentially a place where you have a lot of push coming in. Again, as I said, data quality, integration, and regulatory hurdles are there. And then, of course, you have challenges when you're exploring globally, because there are ethical concerns, clearly, and then there are biases. People, I mean, just going to be honest with you, right now, Europe is actually leading for some time, which is odd because FDA led for the last few years. And then suddenly, EU actually suddenly decided to loosen their competition. And not to mention, I mean, it's the whole wild, wild west. I mean, in India, Pakistan, Bangladesh, Nepal. I mean, what is the regulation? There's none. And then, of course, there's the Far East. We have South Korea, and then Indonesia and Malaysia is separate. And then, of course, we have the whole MENA region, which have one Saudi FDA, but everyone else is just, well, as long as you have FDA, we're good. So there's this implementation, ethical challenges, biases are there. Again, AI is here not to replace you, but is what we call the 5 A's: augment, assist, apply, ambient, and it's semi-autonomous. And then enhance, not replacing physicians. Again, thank you so much. I will open up for my questions and then we'll go from there. Okay, it's going to be hard for me to read. Can the host actually ask questions if
Yes.
possible?
Junaid, I'll fetch all the questions since beginning. Just give me a minute.
Sure, go ahead. I hope you guys enjoyed it.
All right. We have got this question from Jishna. With the help of AI, we can augment these radiology images, thus reducing diagnostic cost. I myself has built one that can convert T1 MRI and MRI to T2 and vice versa. But I never see any such things utilized by healthcare. So what we can do to get our get out model to be utilized in healthcare sector?
Sure. A beautiful question. And the question really is that MRI has multiple sequences. It has what we call measured. Measured means that you can actually measure the actual water molecules, etc. And then the second one is basically called quantified. It is actually, for example, it's a T2 image. I extract it and make a flare out of it, which is a mathematical way of changing it. The question really is that I can generate T2 out of T1, right? Excellent, really good question, which we have been doing, right? I mean, that's what I'm saying. T2 flare is coming from T2, which GE, Siemens, Philips, every other goddamn company has been doing it for longest. That is called quantified, calculated. We started using artificial intelligence now. Now the question really is that am I as a physician going to be okay with just MRI images? So just to understand again, from a product development perspective, what he's saying that you just need one MRI sequence done, which is going to decrease the cost of MRI time from average 12 minutes to 2 minutes, because that's the value. And then you can push more and more MRIs. Clear value on investment. Everyone understands what his question is. First, understand the value on investment. The second thing is, of course, then the question is that why would I be actually able to take up that? The question really is that it is going through, but it is very slow. And the reason behind it is that just look at Hopper, not Hopper. I forgot the name of the company. They actually are generating complete MRIs brain with FDA approval. But again, in US, it is extremely not useful at the moment because we have MRI machines all the time. I'm actually sitting there and I'm looking at it. And then the question really is that, I really need, and I'm at multiple sclerosis diagnosis. I need T2 with enhance in a way that I can say if this is a plaque that is new or not. And honestly, if a generative AI uses the image to come into it, it's going to take me a while to trust it. So again, as I said, trust is a big issue unless you have massive, just again, thinking about from model to product. Number one, There's only one company who has gone through the FDA, which is only for DWI, which is again was already calculated. The only difference was that they were actually changed the process from regular imaging calculation quantification methods to AI based. What I'm saying is that until and unless a true FDA approval process comes through, a massive multi-center, clinical trial is done, I'm not going to be able to say that I'm going to switch over. Because again, people forget sometimes that, have you seen what is the main logo for healthcare? It's actually a snake. I don't know if you've seen that. Actually, the whole point of medicine has been that it developed from snake oil. You know what a snake oil is? Right? That's the problem in healthcare. So we have very, very slow to adopt because we have real significant trust issues because we have been pushed all the way from snake oil to right now, even which is, by the way, we talk to them as a new fad is AI. So most of the physicians over here is going to say, okay, this is the new snake oil. That's the term you use. Until and unless you prove significantly and heavily that this thing works. So generative image making in medicine for radiology is at least 3 to 5 years off. Next question, please.
Sure.
I
Thank
hope
you
I
so
answered
much,
your question.
Junaid. Absolutely wonderful. Thank you so much. Moving forward to the next question, we have got it from Shimul. You mentioned FDA approvals have started coming for these models. Can we assume payers, insurance companies are also reimbursing for these models? Is there any unique reimbursement codes for this kind of AI enhanced therapies?
So again, from a workflow perspective, there's a difference between diagnosis and detection, and there's a difference between management and therapies. So we do not have anything in the CPT code wise. So CPT is the code that we use when we bill for my services to insurances, Medicare, Medicaid. Yes, there are actually significant amount of now codes approved. There's actually going to be 80 new codes applied next year in 2026 because AMA controls the CPT code and they're actually pushing more codes into the Medicare and Medicaid for reimbursement. Yes, insurances are now at the moment paying for it. We're going to see some shift changing, bundling and all of that. But yes, there are now, I think, 120 codes or so. Of course, our both mammogram that we're developing and CT brain, etc. We only develop that has a true reimbursement pathway. That is very important. That's a very important question. In general, the meta question to ask is, who is going to pay for it? So one thing is model, right? Just the previous question, right? Generative AI. Even if you develop this MRI to M2, like who's going to pay for it, right? That's the biggest question because as a physician at the end, I'm going to ask for that T2, and that is going to become a mess. So what I'm saying is that is a very important question. Who's going to pay for it in US? Yes, there are proper reimbursement codes already assigned, and we are seeing more and more of them coming. Next question.
Yes, the next question that we have got from Musa, how can healthcare professionals will be encouraged to continue to embrace the AI technology tools in clinical trials and patient clinical management, especially in hospital setting?
Yeah, excellent question. So there's a bell curve. Bell curve is in general. I talked about the hype cycle. I think I should add that. It's called an adoption cycle. What you're essentially discussing is that, I don't know, let's look at the 10-year history of iPhone, slightly more. 2006 was it launched? I forgot. 2007. Anyway, so what you look at is that when the iPhone launched, I don't know, until iPhone 4, the adoption rate was only 15, 11. Then it shot up and then it went up, keep going up. And then, of course, the Android revolution and everything happened. And then there's a curve. As a matter of fact, right now, it is harder, even more expensive to find a dumb phone, even in India, and Pakistan, than a smartphone, because that is how the technology works. The adoption curve is always the biggest issue. So most people in the first few years, and the 20% of the people are going to be the high adopters. And generally those are the founders like me and most of the entrepreneurial spirits, etc. But then it goes into this adoption cycle, and then eventually you will not find a goddamn physician who doesn't use it. Do you understand? Because that's the adoption cycle. Now the difference between regular adoption cycle, which is iPhone and all of that, and compared to AI, which is again is amazing in terms of uptake, because we have seen how fast the uptake is. Still, it is a glacial speed in healthcare, excluding physicians, to adopt, but the change is coming. And this is the market to be in, to be honest with you.
Thank you very much, Junaid. Um, I can see the question that we have got from Krishna. One more doubt: when big companies like Google, Microsoft, etc., already have inbuilt LLMS and lot of hardware support to create and optimize models for drug discovery and precision medicine. What we mortals without fancy GPUs, TPUs are supposed to do in this field? I really want to do research related to drug discovery, but I'm overwhelmed with the online information and articles. That is pretty difficult to figure out a path. Please guide.
Um, I think I talked about drug discovery a little bit before in terms of the market size and everything. It is a fantastic career choice. I apologize. I'm not an expert in the drug discovery AI part, and I would recommend that you ask someone else. I'm just very honest where I can and cannot help. Hope that answers the question in terms of moving forward. Again, um, we are not into that process, and this is a field that changes every week, and any information I give you is outdated.
Thank you so much, Junaid. I can see one question received across live. This question asked by Richard: how do you balance AI driven automation with the need for human oversight in critical care settings?
So what you're asking is basically the real. Believe it or not, it is not a large language or a technical problem. It is what we call a design problem. And the question at the heart is, in a meta level, is going to be that, hey, is this something we need a human in loop design, which is semi-autonomous, or is it going to be fully autonomous, or is it going to be no autonomy, just pure assist? The question is, for example, I'm going to tell you right now is that if I'm developing anything, that's a very interesting thought question, by the way. So first, understand we are in the high stakes game. Defining high stakes is only two applications: military and medicine. Two M's that define high stakes. Everything else is not high stakes. Everything else, nobody can say critical. No, nothing else is freaking critical. Anything. People think that when AI makes decisions, for example, in war or military, the AI actually fires the missile. That's kind of odd, right? It's not. The decision is actually made when I point the click the button on the screen that go into this area. That is where analysis comes in. That is where AI is actually done. By the time it enters the enemy territory, it has lost connection, communication, it might be shot down, etc. It has to be autonomous. Otherwise, there's no point in it. That's why we developed the goddamn product in the first place. So that's what you need to understand. The same principle applies that when you are actually thinking about full autonomy, semi autonomy, minimal autonomy, you are actually scaling it in a design perspective. You have to figure out what the end goal will be. And with that end goal, you have to do clinical studies, you have to understand risk and benefits, and then go from there. Now, giving you an example: CT brain bleed. It has 97% sensitivity and specificity, but I have to give a powerful blood thinner. If I have a bleed in the brain, it's going to kill you. Am I ever going to put autonomy? No. But breast imaging, yeah, I said mass, it's a false positive. What are you going to do? After the mammogram, you're going to just get an ultrasound, right? Is it going to kill you? No, it's not even radiation. So human in loop and autonomy is a design choice at the level from the endpoint. So what is your endpoint, the result you want to go, and then you have to go back and choose what level of human in loopness you want. HIP, that's the term, at the level of at the spectrum of autonomy you have to deploy at.
Wonderful. Thank you so much, Junaid, for answering all the questions so far. We'll be taking last question as we are already done with the scheduled time for the Q&A. So I request participants, in case if you have any questions in your mind right now regarding the session, you can reach out to Junaid. He has already shared his LinkedIn profile link in the chat box. So feel free to reach out to him. I believe he's more than happy to help you all over there also. So yes, the last question that we have got from Kajal Malhotra. How do you evaluate whether a generative AI tool in healthcare is delivering real clinical value or just a hype?
Yeah, so I think I wasn't able to on my talk on the Canva. It's going to show you. There are 5 values: saving time, saving money, early detection, early diagnosis, and then workflow improvements, etc. Essentially, the definitional goal is that, let's say if I'm the CEO of the hospital, I'm the director of neurology, which I have been. I've been the director of stroke. You're going to come to me and you're going to come with a solution and tell me, Junaid, you buy this solution. What I'm going to say, how is it going to improve my life, right? That's the core question. You're going to say, okay, you're just going to decrease 50% of your time. I'm going to say, great, I love it. But even if you say it's going to decrease your time by 33%, I'm going to be happy. I'm going to tell you to go to the CFO and CEO, right? So what they're going to ask you is that it has to improve by 33%. You have to decrease the cost by 66%. You have to decrease the time by 66%. You have to decrease, workflow improvements, whatever that metric is. You need to improve it, because otherwise it is so hard to make things a huge change in the healthcare, right? I mean, I'm not going to offload an MRI machine because you cannot support Siemens and you only support Philips. Do you understand what I'm trying to say? So what I'm saying is that there are 5 modes, and that is in the presentation. But more importantly, what is not in the presentation is that what is your benchmark? And the benchmark is decreasing by 66%. Otherwise, CEOs and CFOs are not going to even take your meeting. Thank you guys very much for hosting me. Thank you for GSDC for hosting me. I really appreciate everything. And then please connect me over LinkedIn if you have any questions. It's going to take me a minute, but I will definitely answer them. Thank you.
Wonderful. Thank you so much, Junaid, for answering all the questions so far. And thank you very much again for a very insightful session today. I request all the participants, please do reach out to Junaid. We have already shared his LinkedIn profile link in the chat box. You'll find it. Junaid, before I move forward with the
Sure.
session, do you want to share any final thoughts with all of our audience today?
So there are, of course, industries that has moved slow. And then, of course, there's a lot of politics goes into, is insurance company going to get paid? There's a good book called Five Pairs where you look at the US, because there's patient, pharmacy, provider, payer, and then someone else, I forgot. You're going to see mass, significant, explosive adoption over the next few years in every industry in AI. It has crossed that chasm, especially with Grok 3 release and agentic flows. I think it is the time to upskill yourself. Extremely important. I mean, I'm originally from Gujarat, so I feel like India is my second home. So what I'm saying is that you guys really need to upskill yourself. Either you are gonna learn how to use AI, be good at it, or definitionally, and I'm categorically saying it, you will be replaced by AI. Sorry, that's the new truth.
Thank you very much, Junaid, for sharing such a wonderful thought. And it was really a great thing. This healthcare webinar it is being conducted in GSDC for the first time, and it's really good to see that we have incredible panel, including you, aligned for this, and it's going amazing. Thank you so much for being part of it. And so yes, dear participants, I do have some great announcement for all of you regarding the certification. So this is the certification on featured GSDC Certified Learning Implementing Generative AI in Healthcare. So do grab this opportunity where we are providing the amazing discount, which is 20% off, and this is only valid for next certain period of time. So the promo code that you can use is healthcare 25 while opting out for this certification. I've already shared the offer details link and the promo code in the chat box. You can check it out. As let me tell you all, this certification, whatever the certification GSDC provide, that comes along with the lifetime validation, and which gives you learning resources where you'll be getting a lot of case studies to work on, e-learnings and book of knowledge. These certifications are lifelong learnings which comes along with the learning flexibility, and you'll be getting chance to connect with our training partner channel, and you'll be having a lot of opportunity to work on the capstone project, that is something real time AI simulation practice. So do grab this opportunity and do sign up yourself for this certification. Also, this is utility tool. This tool will help you to improve your LinkedIn profile score, your AI skill score. Also, it will help you to build your personal brand, and it will help you to build your resume. So use this code August 100 to get 100% off, and this is only for our webinar attendees. Use this code and check this tool out. It is definitely going to be a very helpful for all of you. And let me make this announcement. Tomorrow we'll be having another session on healthcare, generative AI and healthcare, and we'll be having Eric with us, and he'll be taking us through the topic that is transforming healthcare with generative AI, personalized treatment, and disease prediction. So please do join us on 9th October, that is tomorrow, with the same time slot, that is 8:30 a.m. Central and 9:30 p.m. Singapore time. And we do have this another webinar series going on right now, which is scheduled from 6th October to 10th October on another time slot, that is 10:30 a.m. Central and 11:30 p.m. Singapore time. So please do refer your friends or colleagues who are into this profession. It will definitely helpful for them. So yes, this is scheduled on solving learning effectiveness challenges in instructional design. We do have this incredible panel of speaker aligned for this webinar as well. So please do join us, as we are having 60 minutes of impactful session. Also, we are running this another AI tool challenge. So earlier we have scheduled this for 33 days, and now we are planning to extend it as we got amazing response from the audience, and we are inviting more AI expert who will be giving a live demo with practical walkthroughs on each AI tool. So please do join us for this session. We'll be updating time slots and the dates shortly. And thank you. We do have these three winners. Let's congratulate to them. They have referred maximum people to our session, and they have topped our rank first at our leaderboard by referring people. So we'll be announcing all the winners at this end of the webinar series. So you still have a time to be a winner. Refer maximum people to our session. And if in case if you want to be a speaker for our upcoming events as a featured global speaker, you can definitely reach out to us, as we'll be having global platforms like Learning Capsule, webinars, and the podcast. And definitely we'll love to connect with you all over the social media platform. You can scan this QR to connect with us over the LinkedIn. You can check our website, that is www.gstcouncil.org, to check all the details that I have mentioned regarding the certification earlier, and check all the offerings that GSDC has for all of you. Also connect with us over the WhatsApp group to get daily update on events and webinar or bootcamp that we do conduct. And please do share your reviews on the Trustpilot. It will definitely helpful for us. Thank you everyone for joining today's session. I hope to see you all for the upcoming sessions as well. Until then, take care and keep learning. Thank you everyone. Thank you, Junaid. Bye.